Our testosterone levels drop when we have prostatitis and also during active sex with a woman in the missionary position. We stopped two processes. With chronic prostatitis, about on the 3rd to 5th day, the pain in the penis went away. This means that the pathological process of plaque formation did not stop. A thin formation like a little needle remains. Hello. I will tell you about Peyronie's disease using the story of one person's life as an example. A patient came to see me. Yes. Born in 2002, a very young man who upon palpation discovered pain and curvature of his penis. So he kept looking and looking, and something there didn't seem right to him. He was the first to come to me. He underwent an examination, and an ultrasound of the penis with elastography was performed. A plaque of the tunica albuginea was detected. The size of the plaque was 3 millimeters, located in the middle third without an acoustic shadow. Upon seeing this plaque, I realized and decided that this was the early stage of Peyronie's disease. The patient can be treated. There was perifocal inflammation around it. On palpation, the plaque felt like a round formation, painful to the touch, located in the middle third of the penis. The patient was prescribed additional examinations, biochemical, laboratory, blood tests, and others. As a rule, in such patients, we don't see anything in the general blood test or in any additional studies. We might see a slightly altered PSA. His total PSA was 0.5. For a young man, that's a bit high. PSA should be equal to 0. Your age. His testosterone was 23. For someone who's 22, a testosterone level of 23 is low, guys. That's barely hanging on, just scraping by. And when does our testosterone drop? Our testosterone drops with prostatitis because cytokines are at work and cytokines gradually block testosterone production. Based on this comprehensive assessment, as well as the detailed ultrasound results and the crucial data obtained from the analysis of trace elements, specifically, it was observed that the young man's zinc level was notably low, with his measured zinc concentration being 9. It is important to note that the established normal physiological range for zinc in the human body is typically considered to be from 11 to 19 nanomoles per liter. And based on these three indirect indicators, plus the ultrasound of the prostate, it was concluded that the patient had prostatitis. What happened to him? He suffered a microtrauma to his penis during vigorous sex with his girlfriend in the woman on top position. And since he had prostatitis, this microtrauma started to progress pathologically. And despite his young age, against the background of chronic prostatitis, Peyronie's disease developed. Treatment was prescribed. Physiotherapy treatment. Regarding medications, I will not be naming specific ones for you so that no individuals who are foolish or misguided might attempt to cause harm to their own bodies through the practice of self-treatment without proper medical guidance. I'll put it this way, it was a group of resorptive medications to support health during Peyronie's disease, and they worked very well. There was also anti-inflammatory therapy aimed at stopping the pathological process. There were medications, a group aimed at treating chronic prostatitis. There were also medications based on biogenic peptides, which I deeply respect. Thus, in parallel, we stopped two processes. We stopped the chronic prostatitis. My goal was not to cure it. Now I would cure it medically. If necessary, prolonged treatment is required. But with Peyronie's disease, the following happened. Around the 3rd to 5th day, the pain in the penis disappeared. About a week later on the ultrasound, I saw that the perifocal inflammation had stopped. What does that mean? It means that the pathological process of plaque formation had stopped and it didn't progress any further. Our task was simply to allow it to heal. And about a month later, we saw a normally formed, a scar, yes, in the penis. It could be palpated and it's palpable. If you really try hard and keep feeling around, you can find something like a tiny needle-thin formation left. But that's not a plaque. The process of plaque formation stopped and Peyronie's disease ended there. We managed to resolve it within a month, but I repeat, the young man was young and healthy. He sought help right away. That's what I wish for you as well. All the best.